Our ILAC team here and our team in the Dominican Republic welcomed and tirelessly serviced 5 teams of Creighton healthcare professionals who generously and courageously provided medical care to the victims of the Haitian earthquake. We are extremely proud of these men and women who spent talent, time, and treasure in the service of the suffering. There is no more visible example of Creighton's mission than your colleagues providing assistance to those in need and truly living out in word and deed who and what Creighton University is. I think they deserve a round of applause.
Hello and welcome to this special edition of Creighton in the Community. I'm Joyce Bunger and I'll be your host. Today we are going to meet the medical team that traveled to Haiti during one of the worst earthquakes in our world's history. The earthquake that struck Haiti on January 12th lasted 35 seconds. The 2010 Haiti earthquake was a catastrophic magnitude of 7.0. The Haitian government reported that upwards of 250,000 people had been identified as dead and an estimated 300,000 injured. The death toll continues to rise. Before we meet the members of the medical team, let's learn a bit more about Haiti and ILAC. With me is Terry Lynch, and Terry Lynch directed the ILAC office in the Dominican Republic for years for Creighton University and has traveled many times to the Dominican Republic. First of all, tell us a little bit about Haiti and Dominican Republic and actually how big the island is.
Mm-hmm. Well, the island's fairly good size. 2/3 of it is the Dominican Republic and 1/3 on the western side is Haiti. ILAC has been working in that country through connections with Creighton for over 30 years, and in the Cibao region, which is a mountain region in the middle of the Dominican side of the island. And we also have been working with Haitians that come across the border, and our encatchment area runs 250 miles clear to the Haitian border. So the connection really was the ILAC Center in the Dominican Republic in Santiago.
And let's talk about ILAC. ILAC stands for?
The Institute for Latin American Concern.
And what is ILAC?
ILAC's a division of university ministry at Creighton. It's available to all students who want to volunteer to serve in the Dominican Republic, and it really is a program that emphasizes service, spirituality, and total immersion so that the students learn and grow and are able to experience third world poverty in a way that they learn from each other. I mean, a lot of times we go down with the students wanting to help, but they often come back saying that they've learned much more than they gave, and that there is this exchange of gifts. They may be materially poor, but very rich in spirit, and we find that with the Haitian people as well.
So the ILAC facility, is it a compound? Is it a hospital?
Well, originally the ILAC Center didn't exist when the program started 30 years ago. We worked out of an old seminary in Santiago, but in 1990, a 4-acre campus was established with a church, and that was our connection with the chaplain of the ILAC chapel there. The way that we got to this particular area, called Imani, was through the Jesuit Refugee Services, who said that there were a lot of Haitian earthquake victims pouring across the border in Imani, and that ILAC would be able to get us there. It's about a 7-hour bus ride from Santiago.
Okay.
That there was a great need in that location.
And when did you get involved in this process?
I was helping a little bit on the side, just gathering supplies and figuring out how to help Dr. Philippi, who is really the point person on the Creighton side. And I got a call on a Thursday about 11 days after the earthquake saying, would I go with Team 3? And I'm more of an administrative nurse, and my nursing skills are a little bit rusty, so I was like, well, what can I do? And he said, really need somebody that could help with communication, kind of assessing the situation, should we be sending more teams, and that this particular team would primarily be nurses, because that was the greatest need at that time. So I figured out within a few hours that I could do that, and we were off the next morning.
How many were on your team?
We had 14 on our team. Dr. Teresa Townley was our team leader, and then I assisted her with a communication primarily. We had a satellite phone, but nurses were really needed at that time.
Because?
Because then there were 350 patients on the ground. This was a Baptist camp that had a small hospital, small outpatient hospital, and then several buildings that weren't really occupied yet, which served as the platform for patient care. And I was primarily working in the chapel, where all the pews had been taken out, and
so it was turned into a hospital.
Yeah, the mattress after mattress just lined up one after another on the floor, and there were 350 patients at that time, and a real shortage of nurses. We were essentially trying to staff a 350-bed hospital, and when we arrived, the nurses just went right to work and began to...
And were the 14 nurses, were all Creighton nurses?
No, and that was really a beautiful thing. I met the night before that we left out at Bergen, and then it really was a coming together of the two Catholic hospitals to just respond to this need.
Are there still patients, were there actually patients at ILAC, or is that just where you stayed,
No.
where the team stayed?
There were not patients at ILAC, and that was talked about, but since the need was the greatest near the border, and Santiago and the ILAC Center were not that close to the border, that ILAC's function really was to help facilitate bringing the teams in, getting the things through customs, and then having them stay one night, getting them ready, getting a little bit of respite, instruction, a gentle entry into the country, and then taking them by bus, and also the logistics of getting everybody out of country. It's just not that easy to navigate in any developing country, let alone one where the language is different and you're trying to bring a lot of supplies through customs.
What's one memory that stands out in your mind?
I think the most poignant one was when we were working in the chapel just doing nursing care. It was a very high acuity area. We did have some children, and there was a child probably about 9 who was on a mattress like everybody else on the floor, and she was in the sun, and we picked up her mattress and we were moving her in to the chapel under the roof. It was kind of an open air chapel that served as our higher acuity area, and she just started screaming. I mean, screaming. I thought, are we hurting her, or what's happening? And we were able to get a translator, and she said she was just terrified to go under a roof. And that really hit me, that we weren't just dealing with a lot of physical injuries. We had amputations in children, sometimes more than one limb. We had external fixators. We had just one injury after another. We had 6 spinal cord injuries in that unit, and it really hit me that there was a lot of emotional pain there, and that we weren't just taking care of patients and their injuries.
Within 4 days, a medical team from Creighton University had arrived in the Dominican Republic, and I'm here with Dr. Teresa Townley. Dr. Teresa Townley is the assistant professor of internal medicine and pediatrics for Creighton University. And welcome. And I have to tell you, my image of you was a World Herald article where you were saying goodbye to your little children. And it reminded me that while you were called as a medical professional, it must have been tough to leave 2 little kids at home. What went through your mind when they called and said, Teresa, we need you to go?
Well, when I had heard about the earthquake and saw what the incredible need was there, I really felt like I had to go. So when I heard that Logie was getting some people together, so I think from that moment on, I knew that I had to figure out how to go.
What was the differences in the 4 different groups?
First group really was, really utter chaos. All these people, when they realized that they weren't going to be able to get medical care of any sort in Port-au-Prince, started coming into the Dominican Republic. And we were about 30 miles from Port-au-Prince, and not sure how far we were from the epicenter, but certainly we were accessible by road from some of the areas that were really badly hit in Port-au-Prince by the earthquake. Now, some of the people came with an x-ray they obtained in some clinic or something, but I think it was, most people hadn't got any care, figured out a way to get on some bus or some lorry and got across the border. And when the first group arrived, they were just, the descriptions were, lorries pulling up with horribly injured people, trying to figure out who needed, just utter kind of triage, who needs to go to the OR immediately to prevent them, unfortunately, from dying. By the time I got there, it was still somewhat of chaos. There were still a lot of things, that could potentially happen, but we were able to kind of more figure out who needed surgery, what kind of things needed to be done, trying to prevent medical problems that will often set in, after the initial injury. So it was, and every day that I was there, you could certainly see an improvement in terms of the organization, in terms of understanding what the total need was there. There were still people coming in, but nothing like in the first few days when, trucks and trucks were still pulling up.
How were the teams formed?
Well, the initial team was really thought that rightly so, that the biggest thought would be surgical. So 2 general surgeons from Creighton went down, Dr. Logie, Dr. Lee, and then I think 3 to 4 CRNAs and a OR nurse, and then some ICU nurses. So the idea was really be prepared to be surgical, and they actually, on the plane and as well through the ILAC Center, which does a lot of ongoing surgery, we're able to bring a lot of supplies. So it kind of came as a team, both with in terms of personnel and in terms of equipment, that they'd be ready to work. The big need was nursing care. Creighton also brought a pharmacist down. He was essential for organizing the pharmacy because supplies were also arriving just somewhat randomly. And really needed some organization in order to provide good medical care to the patients.
So what specifically did you do, Dr. Townley? What did you do while you were there?
Mainly, what I'm trained as an internal medicine and pediatric doc. So really kind of going through, seeing somewhat similar to what I do here in terms of seeing patients, seeing what their injuries were, what their complications were, as well as potential complications, making sure that antibiotics were reasonable for the situation. A lot of people had open fractures, which can be very difficult from an infectious disease standpoint. And then, trying to prevent things like pulmonary embolism or blood clots in the legs that can go up into the lungs, which often happen on surgical patients. And then I did a lot of things that I don't normally do here, things like wound care, a little bit of physical therapy, trying to get people up to walk. There was a lot of things that you just had to do to get patients cared for, and that might be anything from picking up a broom and sweeping to changing the dressing to running over to the pharmacy area to get the drugs as they were needed.
How long were you there?
I was there 10 days.
It's a long time. Were you ready to come home?
I was ready to come home. I think that it worked out well in terms of the groups, so we didn't really plan it, but the first group really were in a situation of chaos, and we're able to take it out of chaos to probably maybe organized chaos. And at that point I think things slowed down a little bit from their standpoint, because they weren't operating all night. You know, it wasn't, you know, unfortunately, amputation versus death kind of situation. It was more trying to get a little bit better level of care for patients. So when we kind of came with a fresh set of eyes. And to us, this place that was you know, so much more organized for the first group still, you know, looked like there was so much more to do. And I think that was the same when subsequent groups came, because you worked, you know, pretty much got off the bus and went to work, and fortunately was able to sleep at night, but it was, you know, straight work most of the time. And so as things calm down, it's hard to keep up that level of energy. So I felt that the time that I was there was a good amount of time. Probably could have stayed longer with some rest.
When you were just thinking back on your time, what memory immediately comes to mind?
Well, it was very hard for me to leave my children, and so it was very different to talk to these mothers who had lost children. There was one girl who was there who reminded me very much of my own daughter, and so that was, you know, seeing her getting up and walking for the first time, and both how it was exciting but also very painful for her. And her mom started crying and I started crying, and it was just a different, you know, experience going as a mom.
We often hear the term the Creighton way. Why was going to Haiti so much part of the Creighton way of what Creighton does?
I guess when I heard about this, I felt, well, I have to go. I talked to my boss, and I said, you know, we're fairly short in our division right now. And she said, well, I think you have to go. There was just this tremendous community at Creighton. It was really an entire team effort. You know, some of the people that I think worked the hardest were the people who were here. You know, Dr. Philippi worked so hard to get things organized, to get the plane flights, to get the supplies down there, and just that pulling together of all these different sorts of people.
I'm here with Dr. Charles Philippi, Professor of Surgery at Creighton University. Dr. Philippi played a very critical role here back at home as the team went to Haiti. But before we talk about Haiti, this isn't your first trip of this nature, is it?
Well, I've been involved with the Dominican Republic and the ILAC Center and repeated hernia missions for poor Dominican patients.
Tell what you've done on those.
We have had now 7, this year will be 8 trips. We've done about 840 hernia operations. Had a large team that goes, anesthesiologists, surgeons, a lot of nurses from Creighton, but other parts of the world and country as well.
And just briefly, because we want to get to Haiti, is why are hernias your area of concentration on those trips?
At the ILAC Center, there's a surgical outpatient facility, and hernia surgery is qualified for that in that the patients can be discharged immediately. We don't have any in-hospital capabilities there at the ILAC Center, so hernia repairs are needed. And
because why so many hernias?
Well, there really aren't any more than anywhere else.
Oh, really?
Right, but the poor people in the Dominican Republic really don't have access to care, and there are a lot of laborers that have large hernias that need repair. So it's an outpatient procedure, and it can be done without extensive follow-up. We do some follow-up, but not a lot.
Well, now let's talk about Haiti. You were credited as being the point person back here in Omaha.
Yeah.
Why was your role so critical?
Well, I'm not sure it was critical. I think it was important for somebody to do it. And we had a lot of requests from Dr. Logie. Dr. Logie initiated the whole...
Dr. Brian Logie.
Dr. Brian Logie, yeah, professor of surgery here at Creighton. He realized that there needed to be a quick response, and he organized that, and I didn't really have anything to do with that. I was out of the country at the time. But I saw in my email that this was happening, and because I'd had that previous experience in the Dominican Republic and knew about getting supplies back and forth to the ILAC Center, which was going to be the staging place for this team that was going to go to help the Haitian earthquake victims. I thought maybe I should go out to the airport and at least see what I could do, and Dr. Logie and I talked briefly, and I kind of automatically became the liaison person, at least for supplies, and we didn't know what he was going to find, whether he was even going to be able to get into a place that would be of assistance. So it was rather courageous and insightful that he chose to do what he did. He understood about the mechanisms of injury with earthquakes and knew that there would be a lot of injuries that would need to be assisted, or a lot of patients that would need to be assisted. And so we met at the airport, and he left, and we talked about being in daily contact, which we were able to do. It was difficult, but we were able to do. And then it became apparent that they needed more supplies. The team encountered tremendous chaos on site, and they needed to organize. Dr. Logie was really responsible for organizing a multitude of different teams there.
Not just Creighton's.
That's right. When they arrived in Haiti, and they were fortunate to find a place that was in need, because a lot of teams went down, they didn't have enough supplies, or they didn't have enough personnel, or they didn't find a place to work. But the Creighton team found all of those, or at least had the supplies with them, had the right personnel, which was Dr. Logie's leadership as well. And then there was a good site to go to, but when they arrived, it was chaos. There were a multitude of different teams there, but nobody had organized it. And so Dr. Logie did an excellent job of triaging and organizing, although it took 2 or 3 days for it to get under control.
What were some of the primary supplies that were needed when they got down there? What supplies?
Well, initially, there were no abdominal or chest injury patients that they could operate upon, because when they arrived, those people had all died. And so it was almost all orthopedics. And what they were encountering were 3 different injuries: closed fractures, that is the bones within the skin still, open fractures, bones sticking out of the skin, and those people get septic, and then crush injuries. And the septic patients were dying pretty rapidly, and so they needed antibiotics. As well as amputations. When they initially arrived there, the first few days, they were doing 80 amputations a day.
Oh my.
Yeah.
So you basically needed to find antibiotics. Where did you find them?
Well, he found antibiotics here at the hospital. He took some with him, but Nicole Dolison at Bergen Mercy got about $16,000 worth of antibiotics from the hospital, and we shipped those with the next team. The other thing is that there was such an intense healthcare situation. There was a war zone medicine, really. The team worked exhaustive hours and also encountered some things that a lot of the team members had never seen before. Not only the degree of injury, but the amount of pain, the uncontrolled pain. There was threats of rioting for food and for water, not among the patients, but they were only a mile away from the Haitian border, and they did have food and water where they were, so there was a concern that that might happen. Of course, the communicable and tropical disease threat is always there. And then some of the team members had never seen true poverty. So there was a lot of emotional overlay to all of this. It really required courage to go. Also, the first team didn't know when they were coming back. They had a totally open-ended thing. They didn't know where they were going, and they didn't know when they were coming back. So there was some post-traumatic stress for some of these people. So it was apparent that we needed to get that team out of there after a week or so.
And then did a whole second team went in?
Yeah, we had, actually the second team was just 4 people, and then we had a third team that was 14 people, a fourth team that was 10, and then a fifth team that was 12.
Amazing.
Yeah.
Well, thank you for all that you did for this. Well, we've heard many times so far what an important role the nurses played on the mission trip to Haiti. I'm here with Teresa Keefe. She's a nurse anesthetist at Creighton University. How was this situation different than your trips to the Dominican Republic before? And I should mention, you were on the very first plane that went down.
Yeah. I would say there's really no similarities other than jumping in a plane and leaving Omaha. This was no comparison at all to the trips that we've taken for the hernia mission. The hernia mission's very organized, and we know what we're going there for. We've planned in advance. We've sent supplies down there. It's a pretty well-oiled operation. And this one here, we really didn't know what we would find. Didn't know what we would come up against. Didn't know as far as what kind of patients we would be dealing with, and as far as what we kind of guessed at what sort of supplies that we needed, and took those down with us. So I knew that this was going to be very difficult. I knew that the suffering was going to be at a level that was going to be off the charts.
Well, when we got into the hospital, all the corridors were full of people just laying on cardboard, some on mattresses, and people were screaming in pain. There was fractured arms, broken femurs, open compound tib-fib fractures.
So what was your typical day?
When we went down there, I was the one that stayed behind for the first day because I had been to the ILAC Center there. I knew where all of the supplies were. I knew the people there that I needed to get a hold of, and they knew me, and it just made sense for the one person who knew the center and knew where things were to stay back and collect supplies and then leave the next morning.
So you did surgeries all day?
We arrived that day there at around 3:30, 4 o'clock, and we became the night crew.
What's your most vivid surgery?
Oh, my most vivid surgery would have been probably one where we had a young lady who I knew was dying and very and very sick, and I didn't feel comfortable with knowing that she could probably make it through the surgery. And the resident went out and talked to the husband and said, you know, we don't really think that this is going to be something that helps save her. And he begged us, please try, please take her. And, you know, because he had seen other people go in and everything. I mean, he had traveled a long distance to get there and had waited and waited. So we said, okay, so we brought her in, and when they had decided that what she needed, because her arm was totally crushed, that she needed an amputation, I just said, stop. We're not doing that. We're not going to do this. And they all agreed with me that she needed that we needed to stop. That I thought it would be horrible to have amputated her arm and then to have had her die just minutes after you finish the surgery. And so I said, let's wrap this up. Let's have her look nice. I said, let's take her out back to the back hallway so her husband can be with her while she dies. And so we took her out there, and he crawled into bed with her and just laid there and wept.
Why is it important that Creighton be involved in these mission trips?
I think that it embodies what the Ignatian spirit is all about. I think that to bring hope and to bring care and be that face to those people and be the face of Christ for those people, that is what Creighton's about.